You're listening to Bark and Wag's 15-Minute Vet Talk. Each week, your host, Polly Requa, interviews veterinarians and individuals in the pet industry from across the nation answering pet questions. Bark and Wag podcast is produced weekly for your enjoyment, and show notes can be found at barkandwag.com under the podcast tab. That's BARKNWAG.com. Please remember to subscribe to Bark and Wag 15-Minute Vet Talk.
Welcome to Bark and Wag 15-Minute Vet Talk. I'm your host, Polly Requa. Today we're talking to one of our favorite vets, Dr. Laura Brown, owner of Green Tree Animal Hospital in Libertyville, Illinois, about a question that a listener had. Welcome, Dr. Brown.
Hello, Polly.
So the question today is, can a dog have aspirin?
And the short answer is no.
So what can a dog have if they are limping or sore?
So they cannot take any people medication.
Interesting. Okay.
Yes, because the most common medication that we prescribe as veterinarians is for pain and limping is a nonsteroidal anti-inflammatory medication. So dog world, that is Rimadyl, Medicam, Previcox, Deramax. In the people world, there are drugs like that: Aspirin, Aleve, ibuprofen, Advil. But those drugs for people are dangerous to dogs. It damages their kidneys. It causes GI ulcerations. It's bad for their liver. And dogs cannot take people equivalent medication. I think that just needs to be the answer to any medication that people take.
And within your practice, do you get people that have given their dogs aspirin?
I do. And I think there's actually an over-the-counter dog aspirin sold at like PetSmart or one of the, and someone the other day said she was giving her dog aspirin. And when I asked her how much was she giving, she said, I don't know. She didn't know how many milligrams are per tablet or in the dog aspirin. So it makes a difference of, Chuck the pug dog would not take the same amount of aspirin as an 80-pound Labrador.
Sure.
So it is very dangerous to self-medicate unless your veterinarian has told you what to give. So there are other people medications that we prescribe: Pepcid, Prilosec, Benadryl. So those are some over-the-counter people medications that dogs can take. But if you don't know how many milligrams to give, you don't give a dog the same amount of milligrams as a person.
So when someone gives their dog Aleve or Bear and they come in, do you have to pump their stomach?
Depends on how many they've given and how often. So one aspirin for an 80-pound dog will not be a problem. If they give it day in and day out, twice a day for multiple days in a row, I would guess that their dog would probably develop a bleeding ulcer and start vomiting up blood.
Oh, goodness. Okay.
Yeah. So until it gets to that point, a lot of times people don't even know there's a problem. Because it works, their dogs probably stop limping.
Sure.
The bad part about aspirin in dogs is that it sits on these receptors and their body doesn't wash it out of their system for a couple weeks. So even though they don't, one or two doses probably isn't going to be the end of the world on an 80-pound lab, but a 10-pound poodle, one aspirin. So one aspirin equals 325 milligrams. A 10-pound poodle dose, there is a published dose for aspirin. And a 10-pound poodle would take about 50 milligrams. So one 325 milligram aspirin on a 10-pound poodle is 7 times the dose it should take.
Wow.
So that's a problem.
Okay. All right. So the message to the listeners: no aspirin, no people, Aleve, Bear, Motrin for your dog.
Including Tylenol, which is not a nonsteroidal anti-inflammatory drug. But do not give your dog Tylenol either, because there is a prescribed dose for it too. But if you don't know the prescribed dose, if your veterinarian has prescribed it, then they know what dose, how big your dog is, how much it weighs, how long you can give it, how often you can give it, how much you should give it. But it's not a common drug that I use because it does have to be metabolized through the dog's liver. And just like people, if you're taking multiple drugs, depending on what you're taking, they all can interact. And so there can be just a lot of bad stuff happen. So the message is, do not give your dog any people medication without the advice of your veterinarian.
Great advice. Well, thank you very much for being on the podcast, and we look forward to having you back.
You're welcome, Polly. Always good to be here. Thank you.
Thank you.
Thank you for listening to Bark and Wag's 15-Minute Vet Talk. If you like what you just heard, we hope you'll pass along our web address, www.barkandwag.com, to your friends and other pet owners. Have a pressing question for a veterinarian? Ask your question at barkandwag.com under the podcast tab. This has been a KFR production. Join us next time for another edition of Bark and Wag's 15-Minute Vet Talk.